Hello, I'm Dr. Meenakshi Kher. I'm a pediatric dentist. I'm here today to burst the common myths that a lot of parents have about children and their teeth. The common myth that baby teeth aren't important, they're going to fall anyway, is a really unfortunate myth. While baby teeth will fall, every milk tooth has a time when it falls. It's just the front baby teeth that will fall at an average of 5 to 7 years of age, and every tooth behind that incisor is going to fall in the years to come. So the molars right at the back with which your child chews their food will start to shed at say 10 years, 11, 12, 13 and 14 in some children. Until then, your baby teeth are the only teeth the child has in order to chew their food well. The milk teeth also, along with the muscles around the face, allow your jaws to grow well. They guide the permanent teeth to come out well. Of course, not to mention that the baby teeth give your child a beautiful smile. Unfortunately, baby teeth can suffer the same painful toothaches that a permanent tooth can. The good bit is that this is completely preventable, and it isn't very difficult to prevent dental cavities and to prevent painful toothaches, provided as a parent we know very early what exactly has to be done, right from good oral hygiene to controlling the diet and avoiding sugars as much as is possible. Our children have a lifetime to enjoy sugars, a lifetime to enjoy desserts, but as healthcare professionals, we believe that the later we introduce our children to sugars, the better it is. So as little children, fruits are a great meal that you can give children, a great snack, that's natural sugar. But all other sugars one should avoid until the child is at least 3 years of age. Sugar is highly addictive, and when the child gets used to that taste very early on in life, it's very hard for the child to enjoy other flavors, other tastes, and then the parent lands up being forced to make every meal sweet, and that is a big detriment. It's great that you're avoiding the chocolates and the soft drinks, but we must also be cautious about avoiding the hidden sugars, things that often as parents we are innocent to. For example, when you start the day with a breakfast cereal, if it's a packaged cereal, most packaged cereals have a lot of sugar content in them. Instead, if you made the child a bowl of porridge, that was say an oats porridge, a ragi porridge, and if you want to sweeten it, a fruit, you chop in a banana into it or an apple into it, would make a very, very healthy snack with no added sugars. So that would be great. Biscuits are another source of artificial sugar that many parents are innocent to because of all the marketing that goes behind biscuits. Biscuits are just sugar and starch, maida, and they really stick to the teeth. Any sugar that sticks to the tooth is far worse than the sugars that get washed away easily. For that very reason, potato chips and even banana chips are really bad for teeth. So in your child's snack box and tiffin box, avoid the biscuits, avoid the chips. Bread with Nutella, chocolate spread with jam can be really bad for teeth. Instead, try and stick to more healthy options. It could be, it could be nuts if your child is not allergic to nuts. It could be makhana, it could be corn, or it could be, idli or whatever in your family suits your family. But try and stick to the more natural options. The more home cooked the food is, it's always better. In India, we are obsessive about bathing our newborns and massaging our newborns. If we were obsessive about brushing their teeth, we'd all be just fine. Brushing actually needs to start when that first baby tooth comes into the child's mouth, but most parents are completely unaware of this. If we start the act of brushing early, the child really gets used to it and will never resist brushing, and it becomes a very easy activity for you. Brushing needs to start when that tooth comes out, because the teeth in the mouth that have erupted are exposed to all kinds of food and they will gather plaque. And what that toothbrush does is it removes the plaque, takes the plaque away, and allows the teeth to remain healthy and cavity free. Now that you've decided to start brushing diligently when the first tooth comes out in the mouth and your child is perhaps 8, 9, 10 months of age, and right up to say 2 years of age when your child's a toddler. You need to start with a soft baby brush. Don't use those finger brushes and silicone tips. They don't really scrub the plaque out. So a simple baby brush would be just fine initially, and as your toddler grows older, maybe at 1.5, 2 years of age, move over to a junior brush. Coming to the toothpaste, we like to determine after an examination of your child exactly what toothpaste would be best for your child depending on the status of your child's oral health. But if your child is completely cavity free and you've really started brushing early, then until 2 years of age you could use a fluoride free toothpaste. When brushing for an infant or a toddler, the best position that you should adopt is that you and your partner or another caregiver sit knee to knee. Okay, and you have your infant or your toddler with the baby on your lap facing your partner, head on your lap, legs around the partner's waist. Gently restrain the hands, flip the lip up, and then proceed with the brushing technique. The act of brushing requires a lot of manual dexterity and fine motor skills. So what happens is, to brush adequately is very, very difficult for a child. They will not be able to do it efficiently. And the plaque that you're trying to take out when you brush is a very tenacious, sticky biofilm. So when you do the act correctly, it's successful and really, really quick. So we advise that an adult, a parent or a caregiver, brush the child's teeth till they are at least 6 years of age, and brush for them until 6, brush with them after 6. That means stand there and supervise to ensure that the job is done right. And for many years, I would tell my parents, though I don't know if it's relevant anymore, that until your child learns to tie their shoelaces, they cannot brush their teeth. So they require that kind of dexterity. Position your toddler on your lap or perhaps standing on a stool, with the person who's brushing standing behind the child. For an older child, the same position, the child stands in front of the basin and you stand behind the child. Tip the head up slightly so the child's head rests securely against your body. That way the head doesn't move from side to side and you can do a quick and efficient job of the brushing. Brush their teeth in 6 parts, the 2 front sections top and bottom, the 4 side sections, 2 on the right and 2 on the child's left hand side. Now when you brush, always remember to flip the lip up. When you do that, you can access the teeth really well. So flip the lip up. That's the front teeth you're brushing. Remember to brush both the inside and the outside. That is your cheek there. So you can pouch, put your finger into the pouch, gently lift the cheek, go on the side, the inside and the grinding surface. Similarly in the bottom, that is the cheek, get your finger in, pouch the outside, the inside and the grinding surface. You can also go a little horizontally on the back teeth. In the front again you have the lip there, so gently pull down the lip, scrub the front teeth, both motions and the inside, and repeat the same thing on the other side. Let's now discuss in detail about the toothpaste and the toothbrush and the when and how of brushing. The most important thing we need to remember is that brushing has to happen twice a day, once in the morning, once in the night. Culturally, as Indians, nighttime brushing somehow is not a part of who we are. And we get this complaint very often from parents that the child just doesn't cooperate for nighttime brushing. But honestly, when it becomes an important thing for us as parents, we know how to get it done from the child. So we need to make nighttime brushing important for us, and then we would make it not negotiable for the child, and the child gets the message that this is something I need to do before I go to bed. Nighttime brushing is so critical because it's far more important, by the way, than the morning brushing, because whatever you've eaten through the day, all the plaque that is accumulated, all the bacteria in the mouth, all the sugars in the mouth get removed when you brush your teeth in the night, and that is how you prevent cavities when you're fast asleep. So that is about nighttime brushing. Now coming to the kind of brush. With infants, you could start off with a baby brush. You could go on with that baby brush right up to 2 years of age. However, if your child is prone to decay, if the dentist feels the child has a tendency for cavities, we might advise a junior brush, which will be more capable of removing plaque from the surface of the tooth. But by 2 years of age, you must move over to a junior brush. And the branded brushes that are the 5+ brushes often are the best to be used right from the age of 2, because the bristles are very effective in cleaning the plaque out completely. You can move over to an electric brush or a battery operated brush a little later. That's a question we are asked quite often. So once a child is 6, 7, 8 years of age, you could move over to those brushes. They are very effective and efficient, provided of course we physically take the toothbrush to every surface of the tooth, because that the automatic electric brush isn't going to do for us. But the brushing is more effective and the child is more enthusiastic about the brushing process. Now, regarding the presence of fluoride in the toothpaste, the international guidelines say that fluoride should begin in your toothpaste by 2 years of age. You can start with a regular 1000 ppm fluoride toothpaste, which is all our commercially available adult brands, which have about 900 ppm, and there's a new one that's going to be launched that has 1000 ppm. But between the ages of 2 and 3 years of age, right up to 4 years, you would use much lesser quantity of toothpaste. So at 2 years of age, or if you've been advised to begin a fluoride toothpaste earlier, it will just be a smear of toothpaste. That means a rice grain size, chawal ka dana of toothpaste, which you will push into the brush. And then up to 5 years of age, you can use a pea-sized amount of toothpaste, but it will be pushed into the brush, so the toothpaste is released in small increments. And then you can use a centimeter of toothpaste of at least 1000 ppm fluoride. We advise that the first dental visit must happen when the first tooth erupts, or latest by 1 year of age, because as pediatric dentists, what we provide is what we call anticipatory guidance. That means we guide you about correct feeding practices, we guide you about good oral hygiene measures, and when that sets in early, it really serves very well in the long run. So depending on how the child is being fed, whether you are breastfeeding your baby or the child for whatever reason is being bottle fed, we give you correct advice on how you can continue with the feeding practices, how long you can continue without it affecting the teeth adversely. So when a baby is bottle fed, for sure you must bin that bottle. Put the bottle in the trash can by the child's first birthday. The child can drink from a mug or drink from a cup very easily when the child is 1 year of age. For breastfed children, of course, you would decide to continue breastfeeding till at least 2 years of age. It's the best healthy start to a good life. But once that first tooth comes in the mouth, it's best not to carry on ad libitum night feeds. That means endless night feeds that do not follow a strict routine. Because if the baby is lying down next to the mother and sleeping through the night, she will keep demanding a feed, whether or not she's hungry, more out of habit. And that last mouthful of milk just pools in the mouth. And if the child hasn't started with the brushing, if you've introduced sugars too early, and if the mother or the other primary caregiver has a lot of dental disease, that baby will be prone to cavities in their teeth. Often as parents, we translate our fears unknowingly to our children, and if we've had an experience that's not been so pleasant with our dentist, automatically one thinks, how's it going to be for my child? And the child is as sensitive to your body language as you are to theirs. So if you are nervous about their visit to the dentist, that translates to the child who's completely innocent and they're looking forward to something new. As pediatric dentists, we of course love being with children and we are trained in managing children's behaviors. So our environment is extremely child-friendly. Our staff loves working with children. So even if you are scared, and fear is something you can't take away, it's something that you must work hard on not letting it show. Be nice and cheerful and have your child look forward to people who are there to help them. Meeting new people who are going to look at their teeth and help them stay healthy. And we are completely geared up to make the experience comfortable for the child. All pediatric dentists have very child-friendly environments. In fact, our dental chairs have little monitors on top where the child actually very often watches maybe some cartoons to keep them entertained while we work on them. When there's intensive treatment that's demanding, we use happy gas that makes the child very, very comfortable and is extremely safe. So there are many advanced techniques that we use to make the experience really nice for your child. There's also a lot of preventive dentistry that exists. Unfortunately, as a pediatric dentist, I see most patients when the child is already suffering from some dental disease. And the point is that most dental diseases are completely preventable. So had I seen the family earlier, I could have worked with them. We could have helped them prevent disease in the first place. Now, once we sort out the current issues, that by no means prevents further dental disease. Prevention, 90% of it happens at home with diligent oral hygiene and with control of diet, like we've already discussed. And regular follow-up visits will help us reinforce those very values, as also look at because it's a growing child, so there are changes that happen every day. There are baby teeth that are falling, there are new permanent teeth that come. We do regular fluoride treatments for the new permanent teeth, for baby teeth to prevent decay. We do what are called sealants to prevent disease on the grinding surfaces of permanent teeth. We see when the child requires orthodontic treatment, and we get in early to prevent a lot of the malocclusion. So a lot of prevention also happens with your regular follow-ups. So basic bottom line is, as parents, our job never ends, it never ceases. So once you've sorted out the current issues, make sure you see your dentist every 6 months without fail. I hope you found this interaction helpful, and it's going to help and motivate you to keep your children's teeth healthy and sparkly. If you have any more questions, do feel free to drop us an email and we'll be happy to answer your concerns. And I'm sure you will make that visit to your children's dentist to ensure that you keep their teeth healthy. Thank you.